Much for that lovely introduction. Awesome. It's a huge honor to be with all of you today. Thanks for inviting us. Both Sabrina and I are really excited to talk with you a little bit about our experience around using an equity framework to think about how we're doing intern selection at UCSF. I'm going to go ahead and share my screen. And you should be able to see my slides now. Does that look right? Yes. Okay. Excellent. Thank you so much. All right, so let's go ahead and get started. We have a lot to cover this morning. You see our objectives here on the screen right now. We're going to be talking more about some of these specific biases and how they show up in our intern selection process as we notice them. And then hopefully you'll be able to leave the session today with some specific ideas for strategies that you might be able to think about implementing. And maybe you already have implemented some of these, but hopefully we'll be able to start a conversation around some of these strategies. Our agenda, I'm going to start with this introduction. I will give us kind of the big picture framework around the equity model that we used, and then I'll talk more about individual, interpersonal, and structural biases with full recognition that many of us are familiar with a lot of these concepts. So I'm going to go through those relatively quickly. I'm then going to hand it over to my colleague, the amazing Dr. Sabrina Fernandez, and she's going to talk about how we actually implemented and put into practice this equity framework at UCSF with intern selection. She'll also specifically talk a little bit more about virtual interviews and some of the challenges I know that all of us have been facing with virtual interviews, as well as some of the opportunities. And then we're going to end by talking about the importance of inclusion, because I think it's irresponsible of us to talk about recruitment and in diversity without talking about inclusion. So that's our plan for the hour that we have together. We want to start with a territory acknowledgement and acknowledge that we are speaking to you from the unceded land of the Ramaytush Ohlone people here in the Bay Area. And we have nothing to disclose financially. There's no money to be made in this. I do also want to just share this slide about the growth mindset, which I know as educators, you all are very familiar with. I want to share that neither Sabrina nor I considers ourselves experts in this area. Just like everyone else, we come to this work with our own intersectional identities. And so we're giving this talk from our own research and experiences and our own perspective. I want to honor that many of you, Mount Sinai is amazing. Many of you have been doing a lot of work in this area around diversity, equity, inclusion, anti-racism for many, many years, for your entire career. And so we honor that. We want to learn as well. We offer the work that we've done with great humility and know that we have a lot to learn also. For some of us, sometimes talking about these topics can be uncomfortable. And so that's why I put the growth mindset slide up here. Hopefully we will get a little bit uncomfortable, and that means that we're in our learning zone. So that's hopefully a good sign, but hopefully we'll do a little bit of learning and growing and stretching together today. I also just want to offer this slide that probably many of you have seen before. It feels to me that as we're talking about being anti-racist in our workplace, we also have to do the corollary of that, which is understanding our own journey around anti-racism. So each of us as individuals is on a journey on anti-racism. And so I encourage us all just to consider, where are we along this journey, and how can we move ourselves forward to the next level? Okay, all that having been said, we're now going to jump into some of our foundational concepts. And so I generally open with this slide. I feel like none of us really need to see this slide anymore, but it's always good just to have this framing of why diversity in the workforce is important. And I'm guessing that you already know there's a preponderance of evidence supporting the benefits of having a diverse workforce, right? So we know that diverse workforces are more innovative, more creative, better at solving these thorny problems that come up, especially in medicine and in healthcare, and especially, as we know, have really come to the surface in the past few years with the pandemic. We know that diverse physicians from diverse backgrounds provide better care, and we also know that a diverse learning environment is better for our students and for the student experience. So this is what I call the business case for diversity. We know that diversity makes a lot of sense from the business perspective. And I'll be totally honest with you that I always present this slide and it always makes me feel a little bit weird, and I haven't quite been able to put my finger on why until, as these things happen, you read the right thing at the right time. I've been reading a book called The Wake Up by Michelle Michon Kim. And in that book, Michelle Kim articulates what I consider to actually be some of my challenges as I go through this data around the business case for diversity. And what Michelle Kim says is that we can't expect social justice outcomes using a justification based in capitalism. And I think that's kind of what this does. So what I actually think we need to do is think more importantly that we know that we provide better healthcare, we are better physicians, we are better healthcare providers when our workforce actually reflects the people that we're serving, the people in our community. And so I think the ultimate why is here. Many of you probably have seen this quote before. If you are here to help me, you are wasting your time. But if you have come because your liberation is bound up with mine, then let us work together. And this is from an Aboriginal rights group in Queensland. And so I think this, really the ultimate why for me is that understanding that systems of oppression ultimately impact all of us and ultimately oppress all of us. And so each of us as individuals and each of us in our roles in our organizations play a critical role in either upholding or dismantling the systems of oppression. So I started as the director of intern selection at UCSF in pediatrics in 2017, and I'm going to be totally honest and say that we were not doing a great job of thinking about diversity in our pediatrics intern class and in our pediatrics residency class in 2017. You can see from this chart, we're going to do the big reveal a little bit later on, but you can see in this chart, we were kind of hanging out around sort of 10 or 12% of our residents who identified as from backgrounds that are underrepresented in medicine. And it wasn't that we weren't committed to diversity. It wasn't that we weren't trying different things. Everyone had the best of intentions. Everyone understood why it was important to have a diverse residency class. We just weren't moving the needle very much. And so as I came in as the director of intern selection in 2017, I felt like this was the biggest problem that we needed to address. And as we think about this big question, how do we select a diverse intern class? How do we select an intern class? How do we match an intern class that is more reflective of the communities we serve than what we had been doing in 2017 and prior to that? Obviously, there are a couple of things that come up, right? There's no just one answer to this. And so there's the issue of the pipeline, and do we have enough students who are in medical school and are interested in our program? There's the question of recruitment, who's actually applying to be in the UCSF pediatric residency class. There's a question of selection, which is how are we choosing the people to put on our rank list and what order are we putting people in? And there's this question of retention, and are we actually creating an inclusive learning environment that fosters a sense of belonging? So are folks not only coming to UCSF, but are they interested in staying in our program, and are they telling other people about our program? So it's a big, big challenge and a big question, right? And so for me, what was in my locus of control at that moment was the selection process. And so that's what I decided that I needed to focus on as I was starting to think about how do we improve the diversity of our intern class. And so what is it we could do differently in terms of our selection processes that would help us move the needle here? I show this slide in just about every talk I give. I feel like it's always relevant to the things that I'm talking about. This is from a graphic from the National Equity Project, looking at different levels of oppression, different ways in which oppression operates. And those of you who are familiar with the work of Dr. Kamara Jones will notice that this is very similar to the levels of oppression, the levels of racism that Dr. Jones has laid out in her paper in 2000 called The Gardener's Tale. And so really thinking about the idea that racism and oppression operate on a number of different levels, on the individual level, on the interpersonal level, and then I grouped institutional and structural into the systems level. So those were the areas that I started thinking, if we're trying to unpack how bias is at play and how oppression is at play, how are we being complicit with these things in our selection process? These are the levels that it felt like it made sense to start to look at. So what I'm going to do is start talking about each of these three levels of oppression, the individual, the interpersonal, and the structural. And then Sabrina is going to talk more about our specific experience at UCSF and what we did to address oppression on each of these levels as we were enacting it within our selection process. And I want to just say again that we offer this work and our experience with the greatest humility. We certainly have not solved the problem. We have not eliminated oppression and bias from all of our processes. I wish that I could say we have. We know that racism is always at work and oppression and bias are always at work in the milieu in which we live and operate. So again, we share our experience and we'd love to hear your ideas and your thoughts as well, and what this makes you think about, because we know that we have a lot to learn also. So first, I'm going to talk about addressing unconscious bias. That was the first part of our levels of oppression framework. And I'm guessing that all of you probably are familiar with the idea of unconscious bias. So I'll go through this relatively quickly. I think the most important thing that I want to get across is that unconscious bias actually is an adaptive tool. It's evolutionary. It's what has allowed us to survive over hundreds of thousands of years, right? So if you think about hundreds of thousands of years ago, we were competing against animals with claws and horns and teeth. And many of the decisions we made every single day were life and death decisions. And we needed to be able to very quickly judge our surroundings and make decisions about what to do based on our surroundings. So unconscious bias and implicit biases, these all evolved as protective mechanisms because bias turned out to be very functional for us in terms of these life-saving shortcuts to help us think and help us survive and adapt. And our human brains are perfectly suited for quickly filtering huge amounts of information and very quickly helping us to make decisions, which evolved for a reason, right? They helped us save our lives. And that served us very well for millennia. However, we're at a different point right now. The reality of today is that we're inundated with billions of pieces of information, and our brain can only process a tiny portion of that information. And so the vast majority of decisions we made are affected by our unconscious biases, which means that all of us are biased. You're biased, I'm biased, and it matters, particularly when it comes to making decisions about human resources and social identities. Our biases just start to kick in as evolutionarily, for adaptability, they were meant to do. But it becomes a problem when we use the unconscious biases to make human resource decisions. The other key point I want to make is this point that bias thrives in ambiguity. And so we sometimes hide or we disguise our unconscious biases in these vague kind of gut feelings. And I love this article that was published in 2019 in JGME looking at fit as the F word. Because bias sneaks into words like fit, like that person, oh, they're just not a good fit for the program, right? Or I just have a feeling about that person. And so we really need to unpack, what does fit mean? How are we hiding bias in vague terms like fit? And are we depending on objective data or sort of these vague unconscious biases that give us a sense of unease because it's not what we're used to? And so this idea that bias thrives in ambiguity is something I'm hoping you'll walk away with and think about, what are the ambiguous processes or ambiguous decisions that we will make that are not actually based on objective data? Unfortunately, there are lots and lots of things that activate unconscious bias, and all of these things are things that we are surrounded by every single day in our role as physicians and healthcare providers. So stress, time constraints, multitasking, the need for closure, all of these things prime our brain to try to make quick decisions because that's survival. And that's how we get through a busy clinic day is, if you've got 6 patients waiting, you're going to want to make quick decisions and depend on pattern recognition in order to get through the day and in order to get to the next patient. The other thing that I'll put on here that Sabrina is going to talk a little bit more about is Zoom and video interviews also actually prime us towards activating unconscious bias. Zoom and video conference, as we all know, unfortunately, all too well, such an artificial way of interacting. It's harder to read body language, harder to read social cues. And so that extra energy, that extra bandwidth that we spend trying to decode what people really mean, that actually increases our cognitive load. And when we have increased cognitive load, we rely more heavily on our unconscious biases. So all of these interviews that we're doing over Zoom, it actually can make us, if we're not paying attention, can make us more reliant on our unconscious biases. And so what can we do about unconscious biases? Sabrina's going to talk a little bit more about some of the specific ways that we've implemented these within the recruitment and selection process at UCSF. Some of the things I'll highlight. One is the implicit association test, which again, Sabrina will talk more about, but just as an interesting way to start uncovering and reminding us of our own implicit biases. And then I love this point about managing our context and environment. And so I put the New Yorker cover up that many of you probably have seen from a few years ago, the hashtag I look like a surgeon cover, where just having photos of people who challenge the normative stereotypes can be another way that we start to retrain our brains away from some of the unconscious biases that we have. So that was that first bucket around the individual bias. The second bucket and the second level that I'm going to talk about are interpersonal biases. Recruitment and selection are full of interpersonal biases, right? because all of us are biased. And so we bring these biases into our social and interpersonal interactions. So one of the things that we were able to do at UCSF was to bring in a trainer who specifically has been doing trainings around diversity, equity, and inclusion. And she helped us actually unpack and name some of the specific ways that bias shows up interpersonally. And you're going to get a copy of the slide, so I'm not going to go through all of these. But I do want to point out that it was really powerful for us to have names for the kinds of biases that we were seeing and experiencing in our selection process, because it actually helped us call each other in and have conversations around, I think this is an example of leniency bias, or I think this is an example of like me bias. And it just gave us the language to be able to talk with each other. So I'm going to point out just one type of bias on this slide and one on the next slide. Leniency bias is something I think that I certainly have been guilty of without being conscious of it. It's when we sort of give someone a pass based on their background or their experience, where we wouldn't give someone else a pass in the same way. And so just think about, who are we more likely to say like, oh, that failed class was because of X, Y, and Z. And so it really shouldn't be a problem for this person when they come here for their residency, versus who are we more harsh and more strict with. The other kind of bias I'm going to point out, because I still find, this is the kind of bias that I still find myself, I still fall victim to this one, and I have to be super conscious and aware of my own affinity or like me bias. That's the last one on the slide here. And that, I think, is just a normal and natural tendency that all of us have to connect with people who have similar backgrounds, right? So when Dr. Karani mentioned that I went to Brown University, when I see an applicant who also went to Brown, I used to be like, oh my gosh, you went to Brown. Like, I would get so excited about it. And then I realized after going through this training, like, oh my gosh, that must make the other people in the room feel terrible. And does that actually, am I being more lenient, and am I being more forgiving of that person because I know a little bit more about them, and I'm more likely to think like, oh, because we went to the same college, there's something about them that, I think they're probably fine. It's sort of that vague, ambiguous pass that I would give people because of that affinity bias. I think that the affinity bias is something all of us probably feel, and people often say like, what, then am I not supposed to, connect with people or make connections? And I don't think that's the case. What I think we need to do is just be aware that we have this tendency to perhaps feel more warmly about people who may share some aspects of our own background, and then just think about, am I being equitable, am I being fair about how I'm applying that kind of connection? So in terms of interpersonal bias, what are the kinds of things that we can do to combat interpersonal bias? One thing I found really powerful is to justify our decisions out loud. So define what we are looking for, and then looking for specific pieces of evidence, looking for objective pieces of evidence that help you justify your selection decisions. It's been really important for us, and Sabrina will talk more about this, around engaging a diverse committee in selection decisions, and then actually encourage discussion and create a safer space for productive conflict. So it's okay for folks to disagree. Let's get everyone's voices in the room and really engage in a productive conflict, not have everybody thinking the same way about the same person. I think this idea that we all need to bring in awareness and critical reflection about our own biases and the biases that we bring, and then creating a team culture where we call each other in. And so making it safe to say like, hey, you know what, that actually sounds to me like it was affinity bias. Can we talk a little bit more about that? Or can you tell me more about your thinking? But if we create a space where we can call each other in instead of calling each other out, which puts people on the defensive, that I think helps us create this culture where we can start to make some progress around addressing interpersonal biases. The third big category I'm going to talk about are structural biases. I'm going to talk specifically about structural racism here. And structural racism, I think all of you are familiar with the definition. Structural racism is systematic discrimination carried out through institutional policies and practices. And the dangerous and insidious thing is that these policies and practices then shape cultural beliefs and cultural values that go back and support the racist policies and practices. And so I'll share this slide here, and we're going to bring this slide up again a little bit later because I think it's critical, even though we kind of separated out the different buckets of oppression and the different levels of oppression. All of us obviously know that all of these types of oppression are linked and they all reinforce each other. So this graphic I think is really helpful because it reminds us that we, if we start with our history, policies, and practices around, and really those are the basis of structural racism, they then lead to inequitable outcomes and racial disparities, which then push us to priming associations and assumptions of implicit bias, which then help to reinforce and hold up those racist history, policies, and practices. So important to recognize that all of these things are really linked together. I'm assuming that many of you are, I don't even have to say what this slide is. I think all of you probably know that this is an example of redlining. And I just put this up here just to name that there are many, many historical practices and policies that, again, underlie this history of white supremacy and structural racism that our country was built on. We have many, many systems that were built in this country around privileging of white and lighter skin. The narrative that we have around white supremacy is then codified into policies, and the policies skew resources away from people who we somehow deem as being less than human because of the color of their skin. And then the policies end up impacting health so that the health outcomes themselves are racially disparate. So a couple of very quick examples here. And again, I think that all of you probably know about these. This map up here, again, is an example of redlining. I live in the East Bay, so this is the area where I live here. And you can see that redlining, which was the practice of only giving home loans to people who are from certain economic backgrounds or who identified as white, really influenced who was able to buy homes in this country between 1934 and 1968, 98% of federal home loans were given to white families. And we still see the health impacts of this today. There was a study done at UC Berkeley and UCSF looking at redlining. So this is San Francisco, this is the East Bay, and these are the redlined areas. And this student looked at then areas of with high asthma acuity, sorry, wrong direction here, of high asthma acuity. And you can see that they really pretty directly overlay where there are high levels of emergency room visits for asthma and what areas have been historically redlined. So that's one example of structural racism and how that continues to have an impact today. We also know that the 1935 Social Security Act was a wonderful thing in many ways. However, it excluded farm and domestic workers at that time from accruing benefits. And because many Black Americans were farm workers and domestic workers, 2/3 of Black Americans never received the wealth building opportunities of Social Security. The 1948 GI Bill, again, wonderful in so many ways. However, because it was left to the states to administer, Black veterans in the South were denied access, again, to the wealth building and educational opportunities of the GI Bill. And then we know school segregation continues to be a very real problem all across the country, even though we have Brown versus the Board of Education, because schools follow local neighborhood boundaries and neighborhoods are segregated. The reality is that more than half of students in the United States go to schools that are functionally segregated right now. And there's a $23 billion funding gap between predominantly white school districts and predominantly school districts that serve children of color. So the problem and the challenge we have here is that biased systems not only create inequality, but they secure inequality over time. And the reason this matters to us is because it affects who shows up in the clinical environment. So our trainees, our faculty, and the folks who make the decisions and control where money is allocated. And also obviously affects patient health outcomes. And we could do an entirely different talk about structural racism and patient health outcomes, which we're not going to get into today. Structural racism also shows up in intern selection. This was something that we really had to do a lot of unpacking to try to understand how we were seeing structures of oppression that were actually codified into our selection processes. So all of you probably are familiar with this study from 2017 that looked at AOA and racial disparities in AOA membership. I'll be very transparent. We actually had been, prior to 2017, had been using AOA as one of the metrics to say whether or not you could get an interview or not at UCSF. Obviously, we didn't intend to have racist outcomes from this, right? But it definitely impacted the people who were invited to interview with us with our residency program. We see structural bias show up in other ways in the recruitment and selection process. And so when we look at someone's CV and we say, oh, well, this person looks great, but there's not enough research and community activities, we need to think then, is there a lack of generational wealth? And perhaps this person didn't have a family that could support them or pay for their apartment as they needed to work through college. And they didn't have the opportunity to volunteer to do some of the research and community work that other applicants may have that really kind of fill out the CV. The structural bias shows up when this happened all the time when I was in Sabrina's role, where we get a call from someone endorsing an applicant. And it always made me wonder, who were the connections? How did that person get access to the dean, or who played golf with whom in order to get that phone call to say, hey, I'm really vouching for this person. So this lack of connections, which can also be due to generational wealth. We certainly had a rubric, unfortunately, that gave points for people who went to elite institutions. We no longer obviously do that, but that also speaks to this legacy financial resources and connections that it can take to get into elite institutions. We had a system where we screened applicants out based solely on scores and based solely on scores and grades. And so we just automatically were like, okay, we're not going to even look at these folks. We're going to look at these folks. But we all know now that scores and grades are not necessarily the best and most anti-racist way to look at folks' accomplishments and capabilities. This is an example of where this ambiguity, the ambiguous terms came in, the idea of let's not lower the bar. And here is where we see potentially lack of educational opportunity and also just different valuing of life experience that come up when we talk about the idea of what does lowering the bar really mean. And then this last one that I have on this slide is when we talk about recruitment as mainly a pipeline problem. I put this in as a structural issue because I think it actually gives us an excuse and lets us it takes us off the hook for engaging in problem solving. Sure, there may be a pipeline problem, absolutely. And what is it we can do from where we sit to help unpack and dismantle some of the systems that we see that are impacting our own processes? And so big picture, structural bias, what can we do? I think one of the critical things that I've learned is just starting to look for patterns in the data, because those can be signs that there's a structural problem that exists, right? Like, why do you have disparate outcomes? Let's start looking more upstream at what are the structures leading to those disparate outcomes. Another big lesson learned for me is that we can't assume that systems are neutral. So I had assumed that AOA was a neutral system, and it was not a neutral system as it was playing out for our applicants. This ties into the next one, where we need to focus on impact and not intention. So all the people that built the systems, I mean, when I'm thinking about our residency selection process, no one entered into that saying like, I want to have a racist outcome at the end, or I want to have disparate outcomes. We all enter with the best of intentions. But once we start to look at our impact, we notice that our impact is not what we expect. That's when we then need to go back with great humility and say, how can we unpack some of the systems issues here? We've already talked a bit about bias thriving in ambiguity and how we can interrogate our systems for bias. And then I think this concept that it takes time and it takes courage, I think, to deconstruct our systems and then reconstruct them, hopefully based on anti-racist principles and in ways that can help to unpack and pull out some of the bias in the systems. So I'm going to hand it over to my wonderful colleague, Dr. Fernandez, to talk more specifically about how we implemented these at UCSF.
Thank you so much, Dr. Marbin. I'm really excited to be here. Thank you all for coming and for putting your cameras on. It's nice to see your faces, even from afar. So I'll take the framework that Dr. Marbin already went through with unconscious bias, interpersonal bias, and structural racism, and try to show you with UCSF as kind of a case study of how did we try to look at those three categories and deconstruct our system and reconstruct it from the ground up. So starting with unconscious bias, to reveal the other part of the graph, I wanted to show you the percent of students who I self-identify from UIM that were part of our intern class over the last several years. And this is a graph that we're pretty proud of, that we've been able to make some significant and deliberate changes to the way that we do recruitment and selection so that our intern class is more diverse. And so I'll go through with you a little bit more about how we came to this graph. So starting off with our foundational principles, we really wanted to start off looking at holistic review. I'll go over a little bit more about what that means, but certainly this is a principle that takes a lot of brain power and a lot of people power to look really critically at the entire application. A second foundational principle is we want it to be known by our applicants and by everyone involved in the process that DEI is our priority. And we wanted our policies and practices to be equitable. It's very easy to say our values are DEI, justice, we love all this stuff, but we wanted to really walk the walk, and we wanted to be transparent about how we were doing it. And make sure that our community at every level, from the leadership down to the first-year intern who was helping out with application review, understood why it was important to us. And so this is a table from an article that was published last year in the Journal of Graduate Medical Education. And it goes through UCSF's experience and those three sort of buckets of bias. I would encourage you to take a look at this article. It talks a lot about what I'm going to be speaking to, but if you need to go back and reference some of the material, it's a great article. As far, we can go forward, Jyothi, thank you. I just wanted to also remind you, just to bring this slide up again, that these are somewhat artificial categories and that they all are related and reinforce each other. So with that in mind, we'll start off with unconscious bias and how we tried to tackle it in our recruitment experience. So the first thing that I wanted to tell you a little bit about was the anti-bias training that we set up. Part of what we did was we wanted all levels of people involved in the process to have anti-bias training within the last 2 years. Next slide. So we required it for pretty much everybody involved in the process, from the program leadership to people that were conducting the one-on-one interviews, and for anyone that was involved in the ranking advisory committee. And as far as how we came up with this anti-bias training, we sought the help of outside consultants, Yvonne Hutchinson being one, to design a 90-minute anti-bias training. And I think that one was the most useful way for any folks that were involved in the process to really think critically about their own personal biases and how that is impacting the other levels of bias. What was nice, and what Jyothi went over also, and what was most useful, I think, for participants was the specific case examples. This is how bias is going to show up specifically in your rubric, or this is how bias might show up specifically in your virtual interview. You can move forward, Jyothi. Thank you. Another thing that we did was we strongly encouraged people to complete their implicit association test before the training. The IAT is something that I do on a somewhat regular basis to kind of remind myself of what my personal biases are. And when folks were able to complete that before the anti-bias training, I think it really helped ground them in the discussion and help do some self-reflection before talking about the cases. Because these trainings were in the evenings and not held sometimes on when people could always come, we also accepted training from the UCSF Office of Diversity, as well as some of the workshops and materials that were provided by the AAMC. I think certainly the in-person 90-minute training for our department was the most useful because people were able to see their colleagues and have discussion. One of the questions we had too that we were worried about, anyone who's done recruitment, if the word requirement sort of makes you cringe a little bit because it's such a gargantuan effort with a lot of people involved. And we were really worried, are we going to lose interviewers? Are we going to lose folks to help out with our ranking advisory committee? And we found actually the opposite, that people were really excited to participate in the training. We were able to expand the training to our affiliate hospital over across the bay at UCSF Biniap Children's Oakland. And folks generally came out of the anti-bias training having learned something about themselves, having learned something about the process, and being more engaged and excited in the discussion. Next slide, thank you. So as far as the interpersonal bias, I'll go through a few things there. With that, you can slide forward, please. Thank you, Jyothi. We wanted to make DEI a priority during the recruitment process, and that came out in several different ways. Our program director at every presentation for the applicants made a clear message in her welcome about how DEI was a priority. We included our pronouns on our name tags or the Zoom ID. We made sure that our materials were reflecting the diversity of our program. And we also had applicants include a DEI essay question. Can slide forward, please. Thank you. Other things that we did was we included diversity celebration days highlighting the DEI work at UCSF. So we have panels throughout the interview season, a few panels that include both resident and fellow and faculty participants, highlighting all of the important work that they're doing in advocacy and research related to DEI. We want to make sure that people know that this is something that we're paying attention to and that is a core value. Another thing we did was that we removed applicant photos from materials provided to the Ranking Advisory Committee. If the photo is going to bias you in one direction or another, we just made it so that our ERAS download didn't include the photos at all. Another thing that we did to try to make sure that we were tackling these interpersonal biases and calling people in was during our Ranking Advisory Committee, which is a full day meeting of a lot of people and a lot of discussion about applicants. We had made sure that there was a person assigned to kind of listen very critically throughout the day, pause the discussion and redirect if a biased comment is made, and someone who also could receive direct messages, because we were doing through Zoom, that if, I think that, that might have been an example of like me bias, is can we take a pause and think about that, so that folks, if they wanted to call people in, could do it through a designated person if they didn't feel comfortable making an announcement to the group. As far as structural racism and systems bias, we did several things, and I'll focus most of my attention here. I wanted to circle back to the idea of holistic review. So it is, the definition is a mission-driven selection process that considers a broad range of factors, your experience, your attributes, and your academic metrics when reviewing applications. And I think that the specific selection criteria and how you adjust your rubric is going to vary by your institution based on what exactly is important to you. And I think that there's certainly literature more about holistic review. You're welcome to read a little bit more about it, but it's really an underlying principle that we had when reconstructing our recruitment process. So as far as other things, you can slide forward. Probably the biggest thing that we did here was engaging a large and diverse group of people to participate in pretty much every level. We wanted to make sure everyone understands why recruiting a diverse class is critical. And we wanted the group itself to be quite diverse. We wanted folks having different experiences, folks from subspecialties, folks from primary care, folks who had their research hat on, folks that were advocates. We wanted people to have a lot of diverse identities, certainly racial identities and others. And we wanted the recruitment experience to be varied too. So we have folks on the recruitment advisory committee that have been doing recruitment for 10, 20 years and have really read applications through and through and have seen, lots of different people come through the process, as well as folks that have just participated themselves in recruitment the year before and were an applicant themselves, and each bring a really, really important and different perspective. The other thing is that this group was really involved in several steps of the process, both from the redesigning and refining of our rubric to conducting the interviews themselves and the folks that were helping with the rank list. I wanted to give a shout out to our RISE coalition, which had large representation in the recruitment process. So RISE stands for the Resident-Led Physicians for Inclusion, Social Justice, and Equity, and it was formerly called our Diversity Committee. I'll tell you a little bit about them. It really is one of the resident committees that us at UCSF, our faculty group, is really proud of. They really have pushed the needle with many different efforts, and recruitment is no exception. So there is a recruitment subcommittee of residents who are really interested in recruitment and selection. There's also an outreach subcommittee that's trying to do really wonderful work investing in our pipeline. And a couple of things that those folks did on the recruitment subcommittee is that they would do personalized outreach to UIM applicants, making sure, do you have any questions about our program? And do you, want to talk more? Those kinds of one-on-one outreach. They also participated in those panels that I was talking about that really celebrated the DEI work at UCSF. And then we also implemented what we call applicant UIM affinity socials. So those are resident only evening sessions over Zoom, which I wish they could have been in person, but at least are a way for folks to get together and really have a frank discussion. What is it like to be a Black resident at UCSF? How are you supported by your leadership? How are things going for you in your intern year? And I think that that's a really wonderful space for residents to sort of talk a little bit about what their experience is and ask and get their questions answered about what it's like. The last thing I'll say is that this group, the RISE Coalition, also did wonderful advocacy to have a position of APD for DEI. And so, a lot of different residency programs may have APDs that have specific roles, and ours didn't have a DEI role prior to a few years ago. And so that was a really wonderful sort of systems change that happened to have somebody wear the hat that was always thinking about DEI in our residency program. I would encourage you to check out this article that was published last year. Many of the authors here, actually all of the authors, were former RISE Coalition leadership, and they really talk about what their resident experience was in advancing DEI and anti-racism in our program. And so a few other things about structural bias. We wanted to certainly make sure that, like I've said, that all levels understood why this was important. And the couple of sort of check boxes that we went through in the leadership were, we have a vice chair for DEI and pediatrics as part of our department. The program director is very involved in how we have adjusted our rubric and our recruitment process. The department chair has been very involved as well and supportive. And then there are more UCSF-wide initiatives like the Differences Matter initiative that's in the School of Medicine. And this was certainly, anyone who has tried to make structural changes know that you have to have a lot of conversations with a lot of people, and it certainly helped us feel grounded with our changes on all levels. We wanted to really create this shared mental model of who it is we're looking for exactly and how we're going to push forward. As far as other things go, specifically, we tried to look at our rubric for structural biases, and I would encourage you to look for those very specific branch points that you may have in your rubric. I think anytime you have a cutoff for this or that, I might take a pause and say, what does that cutoff mean and what biases are going into that exact cutoff? So Jyothi gave some examples of things that we've made adjustments for over the course of the last several years. For example, going to elite schools or having extra points for AOA, those things which may contribute to structural biases, we tried to remove. I'll make a note also about academic scoring. It was already a complicated picture that I think was only made more complicated during COVID. So at baseline, even prior to the pandemic, some schools did their third year clerkships on a pass-fail basis. Others did high pass honors. Others did quartiles, or others did just a specific adjective, but didn't necessarily have equal quartiles for all the adjectives. So anyone who has read so many applications from lots of different medical schools knows that it was quite a complicated process to begin with. And COVID only made that a little bit more difficult because, during the pandemic, many institutions went directly to pass-fail or had part of the year being pass-fail and part of the year being honors, those sorts of things. As far as other things for our rubric, we really tried to deliberately reflect on what the characteristics of residents were looking for, and I'll take a few moments to talk about that. So, we brainstormed what are the adjectives that we are looking for. We're looking for someone who is dedicated, who's hardworking, who's resilient, who's involved in their community. And our rubric really specifically for each category gives examples of how you would fulfill that, how an application might show you that teamwork was really important to this person. And I think that was a really wonderful brainstorming session that we did to help ground us in the type of applicant that we want to recruit. And then we had our interview questions try to reflect those characteristics. Next slide. And then certainly moving away from terms like fit to not get stuck in with our ambiguous terms and our biased terms. The last thing we did was we started paying close attention to how many UIM students interviewed and how many students matched. And we tried to discuss those UIM students specifically during our ranking meeting. As far as the virtual interviews, I'll talk a little bit about this. Having virtual interviews certainly may have had its advantages. Students didn't have to spend as much time or money to get across the country to visit here. Any of the admin team at Mount Sinai, I'm sure, is very happy not to have lost many suitcases and had interviewers not show up and those sorts of things. And so for many reasons, it's actually been an advantage. We've been able to also have affinity groups, which is something that may have been harder to do on a in-person way. And then on the other side of the coin, the disadvantages are some of the things we're talking about. So because of that increased cognitive load, we may have our biases kick in, and there's issues that are new. So in someone's internet bandwidth, if I start going choppy, is that something that will reflect poorly on me? You get access into someone's private space. You all are seeing the Golden Gate Bridge, but my messy room is actually in the background that you can't see. And how would that reflect on me if I was an applicant? And then there's just, the sort of loss of those connections that you're able to make on an in-person basis. This is another article that I wanted to call out here, a little bit about specifically virtual interviews and identifying those biases. So I would encourage you to check out. I'm gonna, oh my gosh, I only have a few more minutes, but I want to talk a little bit about how important inclusion is in this work. I read a wonderful article by Dr. Rebecca Fenton on Medium, where she quoted another physician: "Diversity without inclusion is injuring." And so once we have moved the needle with the percentage of UIM residents at UCSF, and if you have moved the needle, how do you focus on the learning environment to make it as inclusive as possible? I think that this is just a short list of some of the things we've been trying to implement here at UCSF. And we, again, come with a lot of learning to do and a lot of interest in hearing how other people are trying to make a more inclusive learning environment. But it's very important to look at the other end of recruitment. Now that we have a diverse intern class, how are we supporting them as much as we can? And so I will stop here. Thank you so much for your attention, and hopefully we've been able to review some of the different levels of bias and brainstorm ways that we can mitigate bias during recruitment and selection. And now I will stop to